We are learning more today about an executive order from the White House to reclassify marijuana to a less dangerous drug. That executive order was signed this week.
Here's what we're learning about it. It could signal a major shift in drug policy and clear the way for medical research. 13 News State House reporter Emily Longnecker is here with a closer look at what it could change here in Indiana as well. What could the impact be here in our state?
Right. Okay. So right now, guys, in 40 states and Washington, D.C., marijuana for medical use is legal. Indiana, though, is not one of those states. But Governor Braun has said before that he's open to discussing legalizing marijuana, in particular if federal policy changes. And now it looks like that federal policy could happen. That change could happen. Right now, marijuana is a Schedule I drug. It's on the same list as heroin and LSD. Under the new classification, it would be considered a Schedule III drug, on the same list as ketamine and some steroids. Some Republican lawmakers have spoken out against the change and urged the president to keep the current standards, citing concerns about public health and safety. The American Legion, the nation's largest veteran service organization, publicly praised the executive order to reclassify cannabis, highlighting the potential benefits for research on veterans' health. Jeff Staker, who heads Hoosier Veterans for Medical Cannabis, also supports the move to reclassify it. Staker uses medical cannabis after taking opioids for a decade to deal with chronic back pain and migraines, the results of his military service.
And I think this is the next step, and it will open up the door for the remaining handful of states that do not have cannabis for medical reasons.
And the president's order doesn't immediately reclassify cannabis. There's still an administrative process that has to run its course, which could take some time. Right now, the timeline for that is uncertain. But Mr. Staker talking today about how this move could prompt Indiana to look at how it classifies cannabis as far as for medical use.
It seems like the momentum just keeps growing. We've seen
Correct.
more and more states move that direction, and now the federal level at that point.
So you have to wonder, how this will impact Indiana possibly in this legislative session. Right now, there are no bills that have been filed dealing with legalizing cannabis in any way, but there's still time, so we'll see.
Okay. Emily Longnecker reporting. Thank you so much.